Botox botulinum toxin A is a medicine for adults with chronic migraine, which is migraine with 15 or more headache days a month, with each headache lasting 4 hours or more. Botox is not approved for adults with migraine who have 14 or fewer headache days a month.
My name is April. During the day, I work as a veterinary technician. I help prepare the pets for surgery and then help with monitoring and aftercare. At night, I come home and take care of my own four-legged crew. I have rescue pugs that I've adopted. We're just one big happy family. How long have I had chronic migraine? I really couldn't give you an exact date. All I know is that it was a steady progression of events. When I was younger, I remember my first migraine was at a math and science competition. As I was trying to work out these problems, the numbers were just kind of jumbled and floating around in my head. I had nausea, light sensitivity, my head was throbbing. At that age, I didn't know it was called a migraine. Nobody in my family suffered from them. I certainly never imagined that I'd be dealing with headaches and migraines ever since. As I got older, the headaches and migraines became more and more frequent. They'd last anywhere from an hour to 5 hours or even longer. As time went on, the headaches and migraines really started to interfere with my work. Nobody can see the symptoms or the signs, it's kind of invisible. I just learned to tough it out. My primary care doctor had tried several things with me and just got to a point where they really felt like I needed to go see a specialist. I didn't even really know that there were specialists for headaches and migraines. After meeting with the specialist, he said I have a condition called chronic migraine. He said I'd probably be a really good candidate for Botox. When my doctor mentioned Botox as a treatment option for my chronic migraine, I didn't understand how that was going to help. But then he told me it's the only FDA-approved treatment for people with chronic migraine, and that it's been shown to help reduce the amount of headache days. He also told me about the risks, like headaches and neck pain. One of the things that did make me kind of nervous about Botox treatments is it's 31 injections. I work with needles all day long, but I myself have a little bit of a fear of needles. Honestly, tiny pinpricks versus less headache days, for me, it was an easy decision. I'm really happy with the results of Botox. One of the things I like best is that I only have to go in for treatments every 12 weeks. I've noticed a definite difference. I'm not living a headache-free life, but I'm closer than I was, and my household is grateful for that.
Botox is a prescription medicine that is injected to prevent headaches in adults with chronic migraine who have 15 or more days each month, with headache lasting 4 or more hours each day in people 18 years or older. It is not known whether Botox is safe or effective to prevent headaches in patients with migraine who have 14 or fewer headache days each month, episodic migraine. Important safety information. Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat chronic migraine. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A, have a skin infection at the planned injection site. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received, have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
I'm really glad to be able to sit here and talk about my story, and if my journey can turn around and help somebody else, it's worth it.